Good evening. This is All India Radio Kohima. I'm Ketholeno with the evening news. The headlines: Nagaland records another spike of 75 COVID-19 cases, taking the state's tally to 1,460. Chief Medical Officer Dimapur stresses on observing all guidelines and measures on COVID-19 to save Nagaland from major catastrophe. Chief Minister Rio hopes Nagaland would soon overcome coronavirus as most of the patients are asymptomatic. And Union Minister Javadekar says India is ready to provide every assistance to increase population of tigers in the world. Nagaland today recorded another spike of 75 COVID-19 cases, taking the state's tally to 1,460. Out of the total confirmed COVID-19 cases in the state, 886 are active, while 569 have recovered and 5 died. Nagaland's highest single-day spike is 90 cases on 23rd of this month. Minister for Health and Family Welfare S. Pangyapom tweeted that Kohima district tested 51 positive, while 10 are in Pak, 7 in Woka, 3 each in Mon and Dimapur, and 1 in Tuensang out of 450 test results received today. In Kohima, 30 persons are from different quarantine centers including Jakhama Army Camp and paid quarantine facility, while 21 were detected from different colonies within Kohima town. The Chief Medical Officer CMO Dimapur Dr. Tiasana Pongana has appealed to all the citizens to be responsible by observing all the guidelines and measures implemented by the government agencies and others so as to save the state from any major catastrophe. In a press statement, the CMO said that the desire of the health department is that there should be low morbidity and no mortality. However, during the past 1 week, mortality among the older age group and those with comorbid condition is increasing, and the number of positive cases among the general public is also on the rise. He said most of the deaths were linked to persons involved in business and shops, which indicates that transmission must have occurred in the marketplaces and shopping areas. Expressing that lockdown has been imposed at the right time so as to save all from getting infected during the shopping and marketing, he said, at this stage, we cannot stop the virus transmission completely, but definitely one can control and contain the spread to a certain extent so as to buy time before we get a vaccine. Pointing that many people were very serious about wearing masks and following the guidelines before the virus was detected in the state, he lamented that after the virus entered the state, everybody seems to be so casual and reckless, which is a major concern for all. He expressed fear that if the trend continues, then the state is headed to a point of no return with devastating after effects and loss of many lives. He therefore requested all to follow every precautionary measures such as social distancing, wearing of masks, hand hygiene, use of sanitizers, not spitting everywhere, avoid loitering around and mass gathering. Dr. Pongana said, if we can follow these, then it will go a long way in containing the spread and maintain a controllable state of cross-infection and transmission. Nagaland Chief Minister Nipio Rio, while condoling the demise of 5 patients who had tested positive for COVID-19, expressed hope that as most of the patients in the state are asymptomatic, while few have mild symptoms, the state would soon overcome the disease. Speaking with media persons in Kohima yesterday, Rio said the increase in positive cases is not only happening in our state but throughout the world, while it is unfortunate that 5 persons have died in Nagaland. Lauding the efforts of the frontline workers, he said that after a few initial lapses for which corrective measures were taken, things are now moving in the right direction. Expressing hope that the situation will soon be under control, Rio appealed to the citizens to follow the coronavirus-related guidelines. All of the 5 deaths in the state were reported from Dimapur district. In view of the detection of COVID-19 positive persons, the additional Deputy Commissioner Futsaro under Pak district has sealed Lasumi village, JNV quarantine center, Seed farm, Jipa, and mission colonies with immediate effect. In an order, the ADC, while informing that the sealing has been done to take effective measures to prevent the spread of COVID-19, said that movement of public and vehicles in the sealed areas have been restricted. You're listening to the news from All India Radio, Kohima. The Health and Family Welfare Ministry said total recoveries from COVID-19 today crossed 9.5 lakh mark. With this, the recovery rate improved to 64.23% in the country. The case fatality rate has further declined to 2.25%. A total of 9,52,743 people have recovered in the country so far, and 35,175 recoveries have been reported in the last 24 hours. The Health Ministry said 47,703 new cases of COVID-19 have been registered in the country in one day, taking the total number of cases to 14,83,156. Union Health and Family Welfare Minister Dr. Harsh Vardhan said that the preemptive and proactive measures have helped in controlling the spread of COVID-19 pandemic in the country. He said the coronavirus fatality rate has reduced to 2.25% and most cases are largely asymptomatic. While participating in the World Hepatitis Day second Empathy e-conclave today, Dr. Harsh Vardhan said it is important to create awareness about the higher risk of morbidity and mortality faced by people with comorbidities like diabetes, obesity, fatty liver, and chronic liver diseases. He said the theme of this year's conclave is Keep Your Liver Safe in COVID Times, which is important in these testing times. Stressing on the mass awareness and community mobilization, the minister said hepatitis has become a global health problem and viral hepatitis is a very common and serious disease in India. He said individuals with viral B and C hepatitis are at increased risk for liver cancer and chronic liver disease. He said, talk, test and treat is the mantra to create awareness in the society. The total lockdown imposed in 3 districts of Nagaland, Dimapur, Kohima and Mon to contain the spread of coronavirus continued peacefully today. State capital Kohima is on the 4th day of total lockdown, which will conclude on Friday. The commercial hub Dimapur and interior Mon district continued it for the 3rd and 2nd day respectively. They would end the lockdown on 2nd of next month. All shops, business establishments, movement of public, except pharmacies and rare medical emergency remained closed in the 3 districts. However, in Kohima, in view of the one-day assembly session on 30th of this month, all legislators and officials concerned have been exempted from the complete lockdown. And Union Environment Minister Prakash Javadekar released the All India Tiger Estimation Report 2018 on the eve of Global Tiger Day 2020 today. He also released a poster on small wild cats of India at the event. Addressing the media briefing in New Delhi, Javadekar informed that India is home to nearly 70% of the global tiger population and it leads the world in showing effective conservation of the wild species. He said, tiger is a precious gem of the nature and its presence signifies that the forest is in good condition. He said, in 1973, there were only 9 tiger reserves in the country, which has now gone up to 50. Javadekar said that, apart from tigers, India is also home to 30,000 elephants, 3,000 single-horned rhinos, and over 500 lions. He said, the country is ready to provide every assistance to increase the population of tigers in the world. To end the news, the headlines here again. Nagaland records another spike of 75 COVID-19 cases, taking the state's tally to 1,460. Chief Medical Officer Dimapur stresses on observing all guidelines and measures on COVID-19 to save Nagaland from major catastrophe. Chief Minister Rio hopes Nagaland would soon overcome coronavirus as most of the patients are asymptomatic. And Union Minister Javadekar says India is ready to provide every assistance to increase population of tigers in the world. That's all we have in this evening news bulletin. Good night.